Hello, everyone, and thank you for joining our webinar. This is going to be a joint webinar between the International Society of Antimicrobial Chemotherapy and the European Society for Clinical Microbiology and Infectious Diseases. My name is Souha Kanj. I'm professor of infectious diseases at the American University of Beirut Medical Center, and I'm the president of the ISAC. Today, we will have a program that has three different parts. At the beginning, I will introduce slides about our organization, the International Society of Antimicrobial Chemotherapy. This will be followed by a presentation by Professor Robert Skov, who is Professor of Clinical Microbiology, and he is a consultant at the Staten Serum Institute in Copenhagen. And he's currently the president of the European Society for Clinical Microbiology and Infectious Diseases, well known as ESCMID. He will be presenting slides introducing ESCMID. And after his presentation, we will hear from Professor Heiman Wertheim, who is Professor of Clinical Microbiology, and he's also the head of the Clinical Microbiology Department at Radboud University Medical Center, and he is president-elect of ISAC. The topic of today's webinar is establishing the pivotal role of infectious diseases and clinical microbiology societies, results of a global survey. And as you'll see from Heiman's presentation, this is a collaborative survey between ISAC and ESCMID, and we're all eager to see the results of this survey. Without any further delays, I'd like to start by introducing a few slides on what is the International Society of Antimicrobial Chemotherapy and what is the scope of what we do at the society. ISAC was founded in 1961 and is a federation of over 100 affiliated member societies. And the aim of the society is to increase the knowledge of antimicrobial chemotherapy and combat antibiotic resistance around the world. This is a map that shows the current societies that are members of ISAC. What differentiates ISAC from other societies of infectious diseases is that we are a society of societies. And as you see, we have representation from many parts of the globe, and currently 109 member societies are affiliated. Now, how to join ISAC? ISAC invites national as well as regional professional societies that are active in antimicrobial chemotherapy, but also microbiology or infectious diseases in general to apply for ISAC membership. And if you ask the question, what is the benefit of becoming an ISAC member? I've listed here down what are the benefits. The ISAC Executive Committee is shown here. As you see, we have the Board of Directors. If you look at the Executive Committee members, whether the ex officio or the regular members, you see we have representation from various parts of the world, and that assures that we address the needs of all continents. And the new added Executive Committee members ex officio were Sabiha Isaac from South Africa and Jose Monita from Chile, really to ensure that we have adequate representation from Africa and South America. Back. The ICC Congress, which is the official Congress of the Antimicrobial Chemotherapy of ISAC, as you see over the years, it's been held in various parts of the globe from 1959 in Geneva. The last two were held in Perth, Australia, and Istanbul, and the next one is in Manila, and that will be in December 2026. And you will see a lot of advertisement for this ICC 2026. Under the umbrella of ISAC, we have many working groups, and I've listed here all the working groups that we have. And the most recently added one is the one studying antimicrobial resistance in displaced populations because of the emergent needs of this study group. The ISAC has two international journals, the International Journal of Antimicrobial Agent, and the editor is Jan Lee. The second journal is the Journal of Global Antimicrobial Resistance, and the editor is Professor Athanasios Tsakris. And this journal was initially founded really, and the founding editor was Stefania Stefani, and really has done a superb job. And Athanasios is the relatively new editor. ISAC Academy, under the ISAC Academy, we do many educational activities. We have the e-learning program, webinars, publications, and others. And all this is available for free for access, including to many educational webinars, such as the one we're doing today. For example, it will be posted, but over the past year, this is a list of examples of the webinars that we've done, and all of them are available for watching on the ISAC Academy. And as you see, the topics have really expanded. It's not just antibacterial resistance. We talk about stewardship, artificial intelligence, bacteriophages, pandemics, fungal infections, and others. We have also free e-modules available, and these are examples of some of the free modules. One of the ones that's very popular is resources for preparing and using antibiograms in hospital settings, for example. Last year, we launched the ABX guide, which is a pathogen-directed guide, free access. This is an online antimicrobial treatment guidelines for global application. And it really complements the AWARE book, where the AWARE book founded by WHO is for empirical guided therapy. This one is for pathogen-directed guide. And I call on all of you to try to log in and see. This is very user-friendly and has a lot of information that can guide clinicians. And as I mentioned, it's free of charges for all people to use. We've been very pleased and really happy to collaborate with ESCMID, and over the past year or so, we've done many webinars together, and today is another example of collaboration on webinars among the two societies. ISAC endorses national and regional events. This is an example of some of the conferences and congresses happening from various countries where ISAC has endorsed them. And the upcoming one for the Asia Pacific Conference of Infectious Diseases, which will take place in Bangkok. And as you see, we participate actively with symposia from ISAC Executive Committee and trustees as speakers on these congresses. The Alliance for Prudent Use of Antibiotics, or APUA, this, as you know, was established in 1981 by late Stuart Levy, and it was merged recently in ISAC in 2019. And under the umbrella of APUA, we do a lot of educational activities, including webinars. We developed antibiotic cards that are free to download for particularly students and fellows, and they find them to be very useful. We publish a newsletter where we have a lot of articles, and as I mentioned, societies that are members of ISAC are very welcome to contribute articles to the newsletter. And we've published a few very useful position papers. The latest was on antibiotic shortages, and these are very popular and are really cited very often, these papers. And these are the APUA board members. And as you see, also, we have quite a representation from many parts of the globe. We meet regularly and plan educational activities. ISAC grants, we have the ISAC project grants. And again, these are important grants. Applications for up to 15,000 pounds are given to young investigators. And it's very easy to apply. And one condition is that the principal applicant need to be from an ISAC member society, and one country must be from a low to middle income country, because the idea is to support research in countries that have limited access to funding. And we've launched recently the Society Strengthening Grant application, and this is to help societies really develop their aims. And Dr. Wertheim will talk more about this after he mentions the results of the survey. And the deadline for application for this is October 31 of this year. And we also have young investigator travel grants to attend ICC 2026, and the call for the grants will open very soon. Follow ISAC on social media to keep up to date with new activities. We're present on all these social medias. And for all questions that you cannot find on the ISAC website, please feel free to email Fee Johnston at this email, secretaria@isac.world. Or if you have any ideas for future collaboration or have any feedback on the ISAC activities. With that, I'm gonna stop sharing and I pass the microphone to Professor Robert Skov. Again, as introduced, he's president of ESCMID, and he will talk about the European Society for Clinical Microbiology and Infectious Diseases. Thank you.
Thank you very much. And I'm very pleased here as president of ESCMID, the European Society for Clinical Microbiology and Infectious Diseases, to be part of this event together with ISAC on the importance of having strong societies within both clinical microbiology and infectious diseases. As said, I'm a clinical microbiologist at State and Serum Institute as my normal work. And here I'll give you a brief introduction to ESCMID. Our mission in ESCMID is to champion medical progress in infection for a healthier tomorrow. ESCMID started 42 years ago, actually as a small group of friends who got together and to try to improve the understanding of pathogens and infections. And this has then grown over time to be a large society, now hosting the largest conference in infectious diseases and clinical microbiology in the world. As you will see here on this slide here, we are taking both individual members as well as affiliated societies as members, or as affiliated societies, you can better say. So we have about 13,000 individual members. As you can see, we are having special attention toward members from low and middle income countries with special low fee for them. And as a member, you will get access to the working groups, which I will present in a second, reduced fee to our congresses and educational activities, access to our grants, free subscription to CMI, and the possibility for young people to apply for travel grants. Apart from this, we have 84 affiliated societies representing many countries around the globe. We also have partner organizations, which is a partnership which ensures the reach to others with similar interest in fighting infectious diseases. We have recently started a network of what we call local champions. This is a network where we really are focusing on getting more young people around the globe, and especially in resource poor settings, in order to strengthen the microbiology and infectious diseases with the assistance of ESCMID. Here you can see the type of memberships that we have for individual members. You can see we have rather the big cadre of young scientist members. And if you look by continent, you can see that a bit over 2/3 is from Europe, but the last third is from all over the different continents. Here you can see a very brief overview over our activities put into education, congresses, events, scientific research, guidelines and publications, and professional affairs. Of educational activities, I really would like to mention the postgraduate education courses, which can either be on-site or online, a very intensive summer school, a 5-day program where you have really close interactions between attendances and the faculty. We have two-year certificate programs in infection control and in antimicrobial stewardship. And we have recently launched an ESCMID Academy for longer e-learning courses. Apart from this, we do webinars, we do mentorships, observerships where you can visit ESCMID collaborative centers, and we do specialty training together with the UEMS. The congresses is first and foremost our ESCMID Global, a yearly conference attracting now approximately 18,000 people, again with special fees for people from low and middle income countries, and with the possibility to apply for travel grants. We recently have had both our smaller conferences or specialized conferences for a international meeting on microbial epidemiological markers and the vaccine conference. And later this year, we have the Global Antimicrobial Innovators Conference. One of the backbones is our scientific study groups, which is where we have 36 different study groups, and all members are invited to become member in a couple of study groups where they have particular interest. We do give a few research grants and awards, and we have especially an AMR action subcommittee and an emergent infection subcommittee, and are now establishing a vaccines subcommittee as indications of 3 areas where we in ESCMID put special emphasis. We're the official collaborator and advisor for EMA on antimicrobial susceptibility testing by UCAST, and we do hold also for the infection control the UKIC committee. As said, we have the CMI and the CMI Comms as our publications, but on top of that, we are making approximately 5 to 6 new guideline projects per year. We are putting out scientific papers and white papers. Last but not least, we have a trainee association, a parity commission, as well as an ethics advisory committee. Here you see the members of the executive committee that holds, besides me, John Friedland, who will be the next or the incoming president, and who is the Secretary General at the moment and the President-elect. Annelies Sinkernagel, who is the immediate past president and treasurer. Anu Kantele, who is our Professionals of Affairs counselor. Philip Delmer Fitzpatrick, who is our Membership and Education counselor. Gülsen Osaka Sahin, who is International Affairs counselor. Jan Kleitmans, who is Scientific Affairs counselor. And Jose Ramon Panupado, who is Publications and Guidelines Counselor. But we also do have a number of ad hoc members, including Jacob Morangilat, who is our ESCMID program committee, Mary Hogan, Director for Education, Holger Rode, Director for the AMR Action Committee, and Xavier Lescure, Director for the Emerging Infections Subcommittee, and Luigi Scudler, who is Director for our Guidelines. Leonard Leibovici, editor of CMI, Angela Hotner, editor-in-chief of CMI Communication, Søren Garderman, UCAS chair person, and UKIC person is Nicola Mutas, and finally Murad Akova, who is our membership counselor. So with this, I will stop and just hope to see many of you next year in Munich, Germany, where we have our ESCMID Global. So mark your calendars. The registrations opens 15th of October, and there will be abstract submissions from 15th of October to 25th of November. And the conference is on the 17th to the 21st of April, 2026. Thank you very much. I'll stop sharing.
Yeah, thank you very much, Robert. And for the participants, as you've seen, we presented introductory slides about ISAC and then about the ESCMID, what the societies are all about. And now we are ready to hear from Professor Wertheim. He's going to talk to us about the result of the global survey that he's done in collaboration between ISAC and ESCMID.
Yes. Thank you, Souha, and thank you, Robert. So you've talked about two important international societies, and we're now talking about more how societies are actually doing in the world. So we did a survey, and I'll show you later why we did the survey. So this is actually showing the results where probably many of you who are now online with us also contributed to. So the survey has also been recently published in the Journal of Global Antimicrobial Resistance. It's also open access, so you can also access it and read it at a later time. So this survey that we did was together with ISAC and ESCMID, and also in particular with the Alliance for the Prudent Use of Antibiotics and the ESCMID Study Group for Antimicrobial Stewardship. So to use both sort of networks to really get a good global overview as much as we could to get an idea how our society is actually functioning across the globe. But before to sort of talk about societies and the survey, it's probably good to have a little bit of a historical perspective on what are actually societies, because also different words. You have societies, you have associations, you have colleges. And already in ancient Greece and Rome, physicians already formed like communities, like collegia, and also we say dear colleague, so that comes from collegia, so a working partner to share knowledge and to uphold ethical standards, with the Hippocratic Oath as an important sort of product from sort of this collaboration. And also in the Middle Ages, you see already in Europe, and particularly in Italy, in Padua and Venice, already around 1250, having actually societies that are important for registering and examining medical doctors. And actually some important British doctors were there also studying in Padua, and the University of Padua is in this picture here below, who also visited and studied in Padua and actually thought, okay, this is actually a great idea to have such a college or a society, and they founded one in 1518, which was also sort of acknowledged by the king at the time, and it was really based on the Italian sort of knowledge that they gained by actually studying there. So it's really inspired by other societies in Europe. So what you often saw that these societies became really officially recognized already early on, so already in the Middle Ages, by either royalty, by kings, or by the church, or a combination of both. They're very, very important for taking examinations, but also on advising on public health issues. And when sort of preparing for this presentation, I came across an interesting quote from a paper from 1977 that these advices that they gave were not always good. And as we're now all infectious disease people here together, so the Public Health Department of Venice asked that society, the College of Venice, in 1576, if the disease that was sort of infecting their city was plague, and they actually denied it. They said it was not plague, but actually it happened to be the biggest outbreak that they had at the time, claiming 10,000 victims. So luckily, I hope we do better now, but it's also good to know sometimes it can also go wrong. So the Royal College of Physicians, actually, this is actually one of the oldest ones that is still around, and it's really interesting to sort of go through their history. So they have a great website and a great archive. And if you look at what they put in their first charter, which was acknowledged by the King Henry VIII, to withstand in good time the attempts of the wicked and to curb the audacity of those wicked men who shall profess medicine more for the sake of their avarice than from the assurance of good conscience. And avarice means extreme greed. So they're really thinking about, okay, how can we avoid greed to have good quality medicine happening? And actually, it went that far that the president at the time was given power to fine and even imprison those who practice without adequate qualifications. So I don't know if Robert, Skov, or Souha, as presidents of their societies, are willing to have that power, but I guess it's good by now we leave that to others to do. Now go to the next slide. So you have colleges, we have societies, we have associations, and there are some probably important differences, but actually they're often used intertwined. And the World Medical Association, they also have their own journal, and they already sort of warn that it's really important for all these societies and organizations that they avoid as much as possible conflict of interest, and to really think, okay, what is their role and what are the roles that they can take? And of course, education, and also Souha and Robert already told that a lot of important stuff that they do as societies is educating, having conferences, but often also licensing can be an issue. So in the Netherlands, we are sort of part also of the licensing trajectory and the regulation. So that can be through an audit. So in the Netherlands, we have societies actually auditing the different departments of their specific specialty to see are they functioning according to what we set out to be the best way of performing your profession. And then we have the representation. So regarding policies or sometimes even in salary negotiations. So the governance can vary from societies. So how democratic are you, and how do you deal with conflicts of interest, and what are your resources? And we'll get back to that. So that is what we sort of set out. Okay, how are actually other societies? So I mean, I've been also president for the Dutch Society of Medical Microbiology. So I know a lot about the Dutch society, but how are others doing it? So we thought also in particular with the national action plans on AMR being launched worldwide, but if you read it in detail, you see actually the role of society is not really mentioned, really. We're more like a stakeholder, as many are, but not really as an important key partner in actually being involved with setting the national action plan or with the implementation. So one, we want to see, okay, how are societies functioning, about membership from different parts of the world, and what is their role regarding the national action plan, so have also some really specific questions. So we distributed this questionnaire, an online survey, through the ISAC community and the ESCMID community, and then we categorized all the answers by WHO regions, but also by the World Bank income classification, so low income, low middle income, upper middle income, and high income. And as you see here, these are the different countries that answered, societies from these countries answered the survey. So we have quite some global representation, but Africa is a bit limited. But you do also see here that also low income, low middle income are represented, and also high income and upper middle income countries. So if you look at the, so some basic sort of demographics of the society, so you have various ages, so you have really some really old societies over 40 years, but you also have quite a few new ones, so less than 10 years, and particularly those were from Africa or Southeast Asia. So you see, like in the low income, low middle income countries, younger societies developing, and also probably it's good to know that potentially these societies can benefit to learn from other societies how to govern, for example. And if also look at the membership, so you also had some smaller societies, but really had also 20 societies with more than 1,000 members, which they are quite big. And also the younger societies generally were smaller, which makes sense. And if you look at the composition of the membership, yeah, mainly indeed clinical microbiologists and ID physicians, but also actually infection control people were quite involved. But so that is also good to know that they are also an important part and people using our societies to share knowledge. So if you look at the governance and the resources, so overall, actually, was good to see that there's quite some structured governance. So often the boards members were elected by a member of the society, but also what you saw that some boards had over 20 board members, which I think is quite large. So less is can be more in that sense. So in that sense, that could be also maybe ungovernable. But in some that the board members were elected by the board themselves. So that is sort of indeed a bit of democracy, but it could become also maybe like an old boys network if you don't watch out. So if you look at membership and staffing, so generally everybody had generally paid membership, or the majority, but they did report there was really a limited resources. So a lot of really limited resources to actually do things that they want to do. And then regarding governance and integrity, so indeed, this is quite important, but for us, it was very difficult to get a good handle. Okay, how is that really done everywhere? But overall, it was good to see that many had action plans or plans and a year report for the past year. So people are really trying to have a plan, do, check, act cycle. So if you look at the activities that the societies that we that responded to the survey, how they did, so we had about 100 people responding. So generally, indeed, everybody had a work plan, for example, or quite a number, and also published an annual report, but not everybody had a newsletter, so the majority actually did not. And about 60% were involved with actually drafting national guidelines, but looking at like regulation and doing audits, that was quite limited. So in the Netherlands, yes, we are involved, but you will see that actually the majority of societies are not involved with this sort of regulatory aspect. And also regarding salary negotiations, so that could also be a conflict of interest if you want to be more involved with quality of care. It's probably good to see that the majority is not really involved in that, but there are some that are part of this. But quite a bit are represented in national bodies, which is a good thing to do, and also good that they are actually acknowledged to play that role. But not everybody, for example, is part in educating. And I think education is really a crucial part that we should do. And you do see that a lot of people or a lot of society actually are struggling to do that, or just not doing it at all. And of course, people are ambitions, but also things that people like to stop. And for example, people responding from Europe societies, they responded that IVDR, the in vitro diagnostic regulation of the EU, that is the thing that they would like to have stopped. Then here we come more to the National Action Plan on AMR that people are in every country are being rolled out, and many people already have national action plans. But if you look at the recent literature on how actually the national action plans are being implemented, you see actually a lot of countries are struggling and they're not really always progressing, also due to lack of resources. But I also think probably due to maybe a lack of involving the societies, because societies are actually your professionals who should in the end do the work. So if you look at the, indeed, yes, overall, everybody who responded said, we have a national action plan, but the society involved in drafting it is 50%, so a lot are not involved at all. Also, a lot of are not satisfied, also about 50%, how they are involved by the government, and that the majority really said, over 80%, that we can contribute way more than we do now. So potentially here is a lot of expertise not being utilized fully in implementing or in developing the national AMR, so in the action plan. And also in the commenting phase, also 50% more or less are not involved with this. And if you look at the implementation of the AMR plans, so is the society represented in a National Action Plan Committee? Well, good to see that about 75% are. But in some, there actually a committee does not exist. So if you look at that, then it's about 50%. And then if you look at the involvement in implementing, actually then it's quite shocking and a bit discrepant and paradox with the above. that quite a few say, actually, we're not involved really in implementing this national action plan. And 50% is also not satisfied with their role in this. So there's really some potential force for the good to actually do this better in the future. So this is more broken down by low income, low middle income, and upper middle income and high income. Indeed, also we have an AMR action plan, and more in high income countries and lower middle income countries. And that if you look at the involvement of society, generally more of the low income countries, but also with the younger societies, they say we have limited involvement, but the numbers are quite low. You have to look also at the proportion responding, and that also the satisfaction with the government involvement is limited. And if you look at the implementation again, so high income countries, generally there seems to be higher representation in AMR committees, national AMR committees, and that also with the implementation, also high income countries and upper middle income country societies are more involved as compared to low middle income and low income. And overall, but everybody really thinks we should be involved more. That is, I think, true for all the different income settings. So overall, I think there's a global willingness of all the societies actually to contribute more to healthcare improvement, which is a great thing to see. And then also seems to be also some good governance structures, particularly of those responding to the survey. So there's also a bias to responding. So how are the ones that are not responding performing? But I think it's important to see there's actually underutilized potential, as I explained before. So they're not always really recognized or engaged as partners. And that, they can really provide and contribute a lot from governance to implementing to education, as mentioned before. But it's good to discuss, okay, how do you ensure good governance and ethics across the globe? But I think an important part that maybe some societies are not functioning to their full potential is also resource challenges. So can you get money from your members? Are they willing to pay for that? If not, can you get it from the industry? But if you can get it from the industry, this can really raise serious conflicts of interest. So that is really an important balance, how to really do that. So strategic involvement. So societies can really support those AMR strategies. So this is a call to everybody to get involved and say like, hey, we can do more, but we have to ensure that indeed we are a trusted partner, and making sure that you have a good democratic and ethical constitution, and you're lacking conflicts of interest, you have good expertise, you can be really that important partner. So this is not new. So also the American Medical Association. So this is a paper in JAMA from about 25 years ago about ethical and practical guidelines from professional and medical associations. This is actually a great paper about how you can avoid this conflict of interest. So on the left, you see the introductory paragraph, but also here that that often there's still some economic and commercial interests that can really harm the trust of a society. So that's really, and if you really can deal with that, then you can be really an opportunity, as it says here in the concluding paragraph, opportunity for the common good. And this is what we really should all be striving for. So I sort of look at it from a distance, and from my knowledge, from what I have done in the Netherlands and what I've seen in other countries in more resource-constrained settings, and also particularly like in Ukraine, where I've been also recently. So you have your hospital, you have your professionals in a hospital, and often they're working in their silos in their hospital, and often within their hospital, also just within their groups of surgeons, don't like to be told by infection control people what to do, or by antibiotic stewardship people. And the good thing, I think, about the society, it allows us to really go across institutions and get professionals who are ready to work together. And in the Dutch model from the Netherlands, also, so the Medical Microbiology Society and the Infectious Disease Society, but also the Surgery Society, we all come together in the Federation of Dutch Societies of Medical Specialists. And that is really great, because if you come with a guideline, a national guideline, all those societies that have to deal with that guideline have to approve it. So you get really input from everybody, and you can also with your regulatory system, also ensure that most people in those hospitals are doing that. Because as a society, we have all said, this is the way we want to work. So this can be really an important driving force for change. And if you look at LMIC, so you see a lot of developments regarding medical specialization, but also here you need to think about the policies and how do you, in strengthening your institutes, how many medical specialists do you need for which country, for which setting? And I think also for these kinds of questions, professional societies can be important, but also, of course, have a conflict of interest because everybody thinks that their specialty is, of course, the most important. And this is also more of a recent paper in Lancet Global Health and talking about professional associations in low and middle income countries, and particularly on Kyrgyzstan, but also having a broader picture that indeed a lot of these associations and LMICs are dependent on donor assistance or commercial interest, but they can be really efficient partners. So there's really a force for the good. So that's also shown can be used for specific needs. But much has to be done for developing these associations and NMICs. And there's a role there for WHO, maybe also for the World Medical Association, but also, of course, for ISAC and for ESCMID to invest in this area. So twinning programs could be a way. And then in the end, to make sure that these associations can really play their crucial role in shaping and in the quality of healthcare in their country. So really an important force for the good, which is still being underutilized. But a very nice example regarding AMR in India from 2024, where the government, where the Centers for Disease Control from India, where many different societies from many different specialists came together to discuss. So this is a way to go. So this is really a nice example, published also recently last year. So in the end, and to conclude, and with some recommendations, so societies are essential stakeholders. They are really important to drive the change. And I think with AMR, we are talking about driving change. So that's really need to ensure that these societies can play that role, but they need to be recognized. So it is important that one, policymakers engage them, but you have to be seen and to ensure that you're providing good quality expertise and also make sure you have no conflict of interest. So collaboration, so mentoring programs, training programs, that could be a way forward. And that it does require some strategic investment. So it's good to see that ISAC now has this grant application scheme for societies in particular. So not for individuals, but really for societies to come with a plan. How can we strengthen ourselves and to be better in the future? So I think this is where I will end and stop sharing, and it will be great to have a interesting discussion on this issue. So over to you, Robert, I think, who will deal with the questions.
Yeah. Thank you very much, Heiman. Robert. So
yeah, thank you very much. Oh, Heiman, this year was really interesting, and obviously we are very interested in having more questions. We have already answered quite a bit specific questions in the chat. In the question and answers box, where there has been questions about if you can join, or how you can join the two societies. And as Souha mentioned, ISAC is a society of societies, and there you have to have your society apply, but Souha, you can add if. But ESCMID, there is a possibility for you as an individual member to join, but also have your society join as an affiliated society. Then there has been questions about publication fees for low and middle income countries. And Souha, do you want to speak about the ISAC position?
I think just to reiterate on what you correctly stated, Robert. So ISAC is a society of societies. So if your society is a member, automatically you are a member and eligible to apply for the grants. But we do not have individual membership. Regarding the journals, I think so for IJAA and JGAR, there is no publication fee for page publication, but obviously for open access, there is a an open access fee. So if you are interested to publish in these journals but cannot afford the open access, you can elect to still publish, but it will not be open access.
Yeah, and I can confirm this is the same for ESCMID. We have the CMI where you can submit, but that will not be as open access. But the CMI comes is a fully open access, so that will come with a page charge for that one there. This is more a statement that this is Lucinda Lazar, who says that they really concur that these societies should work together and across specialities. So I think we all, for the two societies here, are very interested, are very agreeing on this. Then there is some special or answers about the funded observerships. I will type an answer directly there because I'm not sure this is of interest for all. Just to say very shortly that the funded observerships that we do have in ESCMID, these are for young scientists and only for young scientists, even though that we fully agree that elder scientists, including myself, periodically needs updating, and we have decided that this year is focused on young scientists. I will just thank Dimitris Stepansky for a very encouraging note on that the ESCMID Summer School has been the best professional event that ever happened in his life. So he encouraged people to participate. I can only do the same. But there is a question for Heiman here. And what's the role of the societies in developing what's the role of the societies in developing undergraduate medical curriculum explored? I believe education in AMS, AMR should start already during medical studies. Heiman?
Yeah, so that's a great question. So we did not do it in that detail. So we did focus a bit more on postgraduate, like more continuous medical education, which is often a part for societies to take on. But you do now see, so this sort of like, are you shaping behavior or are you changing behavior? So I fully agree. Shaping behavior is better, and you do it as early as possible. So better in the curriculum. But in here, that is, I think, the representation role that societies have and can have, and for advocacy, that if they think there's a problem, they are often an important voice that can go to medical institutes that provide education to see how they can enhance their curriculum, or to provide professors or teachers that can enhance their curriculum. So we didn't study it, but of course I fully agree that societies can have a role in it. But I don't know how Souha or yourself, Robert, look at this issue.
ESCMID is focusing its activities on the postgraduate part, but we have actually discussed a bit whether to do it on the pre-graduate also, but right now we are focusing on the postgraduate part.
Yeah, definitely this is something that we can think about. How can we integrate what we do to interest the pre-graduate? That's something definitely that's worth exploring.
But you do see this indirect trickle-down effect, at least in the Netherlands. I see it. So we have, Infectious Disease Society, we have the Microbiology Society, and all the people, generally all the medical specialists are member of their respective societies, so they know all the guidelines. And what you do see, that also in my teaching, I reflect what is the principles also of your society. Yeah, so how you should do things. So I think maybe there's not a direct role, but I think they indirectly do influence through their members, who are often a professor or a teacher in a certain curriculum. So, but not explicitly, but more hidden influence.
Yeah.
So one question more for you, Heiman. This is from Jiva Marguno, who is asking, I noticed that one of the function of a society is salary negotiation. How would that work?
Yeah, so that will differ so by country. So I think you should not be involved in that. So in the Netherlands, we sort of split that function from the from our society, for example. So I think you should stay away because that's a definite conflict of interest. So and what you do see that, so I know, for instance, in Suriname, their medical society is often involved mainly with, negotiations and more sort of, professional affairs, so to say. But there is a desire, for instance, there to change more to a quality of care society. So you do see a lot of ambitions, but often you come from somewhere. And also in the Netherlands, we were also more a society that were involved with salaries, but actually now it's a society involved with guidelines, teaching, and so on. And actually, you see all that stuff going to the background and becoming less important.
I have
And
one
then there
that
is,
I,
oh, sorry. Yeah,
oh,
please,
sorry.
please.
Just because I know Heiman would love to answer this one. I know he's really a big fan of doing so. A question from Dimitro Stepansky. What is the role of professional societies in fighting misinformation? And Hyman, you might comment on our published statement regarding vaccine, etc. Yeah.
Yeah, so I mean, we have a crucial role, but also all our members are crucial. So one, we should make sure that we differentiate and we stay scientific. And I think both ESCMID and also ISAC, we have statements that we want to work in a scientific way. But communication is crucial, and if your communication is not in good order, then you're losing out. So what you do see that on internet and social media, we're losing the sort of the fight on social media, so to say. So there's actually now you see some developments to sort of counter sort of the tsunami of misinformation and disinformation to get a tsunami of good information. But how do you do that? So you have to create communities. It's a lot of work. But we have to get, so to say, an army of for the good, and I think professional societies can play a crucial role in doing that. So, fully agree.
Then we have a question I think goes for all of us, but Heiman, please, this is from Luigi Scudler, who is asking, what should we do to stimulate a more active participation to the society's activities?
Yeah, I think inspiring and showing what your potential could be. So societies who are a bit struggling, or so you to sort of say, okay, reach out to a society which is well established, and of course, you should not tell how to do it, but just sort of to inspire what you could do. So sort of having this twinning, I think that could be really a way to go, but you have to get your governance in shape. So one, what you often see in certain countries is that sometimes you have competing societies on the same, I think, in principle, I think you should, for one sort of medical specialty, you should have maximum of one society and not having competing society based on history or a 20-year-old same chairman, often the men in that position. So having also a democratic system that, people are refreshed and you have new faces and new ideas. So I think that is quite crucial. And you often see societies disintegrating if you have the same people who are still retired, still in the same position in their board. And that is often what you should not do. Over.
Yeah, Luigi, so happy to see that you're joining actually. And I just want to say that one of the idea of doing such a webinar is to really increase awareness of what both societies are doing, because a lot of people, when we meet them, they're not aware of the full scope of what societies are doing. And as Hyman said, the more individuals see what is the scope of our work, the more we feel they are more compelled to join our efforts. So it just increases awareness of the potential of what we can do together when we work as international societies.
Yeah, I also would like to chip in here and say thank you very much for this really important both question and statement, because I think we see this very many places that people are entering societies, but the true benefits, both for the society but also for you as an individual member, comes with active participation. And no society is stronger than the membership base that they have. So this year is really important that people would, I would say, not just join, but actually join actively. And my experience, at least, is that this is highly rewarding.
Yep, fully agree.
Let me see. I saw another one. Yeah, this is a good one for you, Hyman. Are there any suggestions for newer societies to have a more stable source of funding for its activities?
So what's the question exactly? Because of course funding is always crucial, but
Yeah, but how have you any suggestions to how to get stable funding for society's activities?
yeah. So so I think it should come from the members in general. So that is crucial because so what you see also in the Netherlands that the members generally so the membership fee in the Netherlands is quite high. So it's like almost like $1,000 per person. So it's quite a lot. But there's a lot of benefit because you have one very good representation. It's very crucial for the quality of care. So generally, everybody just joins. But of course, $1,000 is not, representative for other countries. So, but you have to start somewhere. And another source of income, but you have to really make sure that your constitution is done in such a way that if you have a good meeting, of course, you can get sponsorship. But make sure that you have a variety of sponsorships from different companies and not just one company, that everybody is there. So you're not depending on one person, and ensure that still your meeting and the science represented there is not depending on the company there. So to ensure that your governance structure and the people deciding on who's the speaker is not depending on who's the sponsor. And if you're able to really show that and have that really well done in your governance structure, I think that could be another source of income from these kinds of activities. But there is really the devil in the detail. So to really make sure that you do this really with high integrity.
There is a comment or a question from Bulent for retired physicians who are not able to attend the ICC, asking if they can have access to the web material of ICC. I think what we've done over the past two ICCs is all the plenary and keynote lectures have been either posted on the ISAC Academy, and on the ones that are not, we're trying to represent the material in a webinar. So you will have access to at least the keynote and the webinar and the plenary sessions on the ISAC Academy. Please visit it and you'll see there's a range of topics that are there. There are a few questions related to ESCMID. I'm gonna let Robert answer those about age limit for summer school and
I've done some of them in the chat, but I just wanted to say that for ESCMID Global, the content will be released January 1st the following years. So there is a wealth of opportunities in ESCMID to see the former ESCMID Global. So just to say that this is a possibility.
A question from Wani about joining work on AMR. So Wani, I think you're from Indonesia, and if you like to be part of any of the current study groups, you just please communicate with the email that I provided at the beginning, Fee Johnston, and we'll be happy to consider that. And so email communication will be the way to go.
Then there is a question here. Can a union which has a component of professional improvement be a member of ISAC?
They can apply. We always look at exactly at sort of at the constitution and scan it what they really do. But I can imagine it in potential, yes. But we need to see the website and so on. So we always do a check to ensure that it's really about needs healthcare improvement.
Yeah, so I think we have criteria for accepting any societies or unions in ISAC. So if you're interested, just submit an application also to the same email provided, and we will review it, discuss it, and get back to you. Obviously, any societies or unions working towards AMR, infectious diseases in general, infection control, etc. So it has to be within the scope of what ISAC is about.
So thank you very much. I think we're getting close to the end. First of all, I really would like to thank our ISAC for taking the initiative for this. And I think that this webinar here, and also thank you to all of you who have participated in the ISAC ESCMID survey. And I think forming a strong societies around the globe is really important. It's also extremely important what Heiman reiterated, that please try to get along together and join so you are strong instead of being in conflicting societies around, especially on a national level. For me, this year is a proof that as we have societies, big across national societies, that is having slightly different focuses, it is still very important, and we are very happy to have this, that we are collaborating together to strengthen the world against infectious diseases. So with this, I will conclude from my side and hand over to you, Souha, for any last words.
Yeah, thank you very much, Robert, and thank you, Heiman, for initiating the important survey and presenting the results. We had over 800 registrants for this webinar, which really reflects the interest in exploring what societies in infectious diseases can do and can offer. We had over close to 300 participants in today's webinar. And as a reminder, this will be also posted on the ISAC Academy. So for people who registered but were not able to attend today's webinar. And with that, I really like to thank everyone, all the participants, for your engaging questions and interest. We've had a lot of compliment in the chat about how interested people were in listening to the presentations. And with that, I'd like to thank Fee Johnston for all her really guidance and follow-up to make this a successful event. And see you very soon with another ISAC ESCMID webinar. Thank you.
Thank you very much, and thank you for joining.
Thanks all.